urgent care. For those of you that don't know me, I'm Patrice. Welcome to my DMP life. I am a family nurse practitioner that practices in internal medicine full-time and urgent care part-time, or PRN. I've been a nurse. I've been in the medical field. Wow. For going on 11 years. Of course, first as an RN specializing in intensive care, and then on to nurse practitioner. I thought I'd bring you guys. Wow, it's early. 6:30 in the morning. I thought I'd bring you guys with me as much as I can to see a day in the life of an urgent care nurse practitioner. So yeah. So here is our ED track board. It has all the patients that are in the clinic as well as their complaint, and then the provider is noted, and then you've got different things on the side like results, labs ordered, imaging ordered, any special comments, and then how long they've been here. And this is what a typical board looks like. Hey y'all, so my shift is over. I didn't get the opportunity to actually film any patient care, of course, because of HIPAA, but I couldn't show you like the exam room or anything like that because it was so busy. So it's Sunday, and of course we're in flu season, and every child that I saw today had the flu or had flu exposure. So I've been treating with Tamiflu all day. I had a few people. One man had a laceration to his right leg that I sutured. I had a UTI, a couple of UTIs. A man with prostatitis who presented with hematuria. But pretty much a busy day. I like working PRN at urgent care here because we get the opportunity to, one, see kids when I don't normally see children at my full-time job, but two, I also get to I don't know what this lady is doing, but two, I also get the opportunity to work shorter shifts. For instance, today my schedule was from 8 to 1, but my relief came in early, so of course I was able to leave at 12:30, which is great, and I still have the rest of my Sunday. Normally during the week I'll pick up a short shift on Thursdays from like a 5 to 8 or a 5 to 9, which is not too bad either, and it's good, quick, extra money. So the urgent care is staffed with primarily nurse practitioners and physician assistants. We have three physicians, but I know they're not hiring any more physicians. They're going to be led by mid-level providers from now on, and my assumption is because you can pay us less, and you can put the physicians in other parts of the hospital. But anyway, but yeah, there's 4 providers on shift every day. Most of them work 8 to 8, and then, like I said, we have some shorter shifts where people work 8 to 5 and then a 5 to 8. It's just very flexible, which I love because it works with my schedule, especially when you want to pick up some quick money or make some quick money and pick up that shift. Normally the volume is pretty high. We see, I don't even know how many patients we see in a day, because like I said, I'm only there for short shifts, once a week or once every 2 weeks or so. But the volume's pretty high. I'll say when I normally work a 5 to 8, I could easily see between 20 and 30 patients in that short amount of time. So, and just imagine that times 4 with the 4 providers. So it gets really busy in there. So in the urgent care, we it's like a glorified clinic for those of you that don't know. We have a few labs that we can do, like we can do BMPs, we can do like a bunch of point of care stuff like UAs, flu, rapid strep test. We can do a BMP. We can do just normal point of care testing. We can do point of care STD testing as well. But we also have the capability to, of course, send it to the lab and get results back pretty quickly too. So that works really well. Our facility is staffed we have medical assistants as well as EMTs, and they work to the highest capability of their role or their license or whatever they hold. So they do all the EKGs, they do all the point of care testing. We also have 2 registered nurses that are on staff too. So it's pretty well staffed. We have a lot of support. And the RNs, pretty much, they do a lot of the stuff that the medical assistants and the EMTs do, plus more. They work to the highest capacity of their license as well. But it always runs smoothly. It's always well staffed. The people there are so friendly, and I don't feel like I don't know, sometimes, when you only work that 1 or 2 shifts a month, you kind of feel like, I don't know, you don't really know people as well as the other coworkers know each other that work together all the time. But everybody's friendly, everybody's helpful. The medical director is amazing, prior military guy. So it works really well there, and it's really quick money. I'm not going to say it's easy, because sometimes when you work your 10-hour shift and then you go there on your off day, it's just kind of overwhelming, and your brain doesn't get that opportunity to like recharge and kind of not think about anything related to patients or anything like that. So it is mentally exhausting, especially when you have it on top of a full-time job. But like I said, it just runs so smoothly, and the time goes by so quickly because you're busy, that you just have to, there's no way I would give up that position. Plus, it also allows me to keep that experience with pediatric patients that I don't get in at my full-time job. I try to pick mainly the pediatric patients so I can keep that skill up and know what I'm doing, because if you don't do it every day, then it becomes foreign to you. Like their medications are different, their assessment is a little different. So I like to pick the pediatric patients just so I can stay on top of everything that's up to date and my assessment skills. Now, I also like to pick the patients that have lacerations or any type of procedures that I don't get to do in my clinic. So a lot of suturing, a lot of dermabond use. I do a lot of eye exams because to me, eye exams are like not my comfort zone. So I try to do those so I can become more proficient at it. But I try to pick mainly the patients that the type of patients that I don't get to see day to day in the clinic setting. So it works out pretty well. So not only is the pay pretty good, the experience is good, the culture of the hospital is great. I don't really have any complaints besides it taking my day off, but I mean, it is what it is. But yeah, so if urgent care, or if you're tired of the clinic setting, urgent care would be a good setting for someone that is tired of the clinic, but you don't want to quite work in the ER, because it is a good middle ground as to what you're doing. But I will say, I will go back to what we are able to do in the clinic. Like I said before, we do the point of care. But we only have an x-ray machine. So a lot of the patients that come in there with today we had a man who had a recent right knee replacement, and he was complaining of shortness of breath, chest pain. So the concern was for a PE, but we don't have a CT scan to actually rule that in. We don't have an ultrasound machine to do a Doppler for a DVT. We don't have any of those capabilities. So it is frustrating in that respect that we don't have everything that a stand-up ER would have. But at the same time, we can easily stabilize a patient and send them to the ER as quick as possible. So you kind of get the best of both worlds. I would say it's like a glorified clinic per se, but I enjoy having the x-ray and the lab there, because we are responsible for reading our own imaging. So, I mean, you can of course wait for the radiologist, but who knows how long that will take. So it also keeps your skills up as far as imaging and interpreting your images and interpreting your EKGs, and so your skills are kept up. So when I move to whatever my next job will be, I feel like I'll be more marketable, because I haven't been stuck in the role of internal medicine, and my skills are rusty. So that's another reason why I do not get rid of the urgent care job. It's because I know that the job that I'm in currently is not going to be my forever job, just because of relocation purposes. But if you have any questions about urgent care or interested in urgent care, feel free to post questions or comments in the comment section. I can kind of give you my insight. I've been there for 2 years. That was my first job where I started as a nurse practitioner, and I've learned a lot, and I'm still learning a lot. So like I said, any questions, you can put them in the in the comment section, and I'll address them there. And I look forward to talking to y'all in my next video. So thank you for taking the time to watch my video. I hope this helps someone out there, or future nurse practitioners or current nurse practitioners, or people that are just curious about what we do. I hope this answers some of your questions.